Thank you very much, Mr. Speaker. Canada is the only country in the world with a universal healthcare system that does not provide universal prescription drug coverage outside of hospitals. People in Canada pay among the highest prices in the world for prescription drugs due to our patchwork of 100 public and over 100,000 private drug plans. As a result, we lack purchasing powers and many Canadians do not get access to drug coverage. The Liberals have promised universal pharmacare to Canadians decade after decade, and still no universal pharmacare. The NDP tabled the Canada Pharmacare Act in February of 2020. Immediately following the last election, the NDP began working to draft a legislative framework to enable the implementation of a universal, comprehensive, and public pharmacare program. It is based on the recommendations of the Hoskins Advisory Council on the Implementation of National Pharmacare and modeled on the Canada Health Act. The Canada Pharmacare Act specifies the conditions and criteria that the provincial and territorial prescription drug insurance programs must meet to receive federal funding. This includes the core principles of public administration, comprehensiveness, universality, portability, and accessibility. Universal public drug coverage has been recommended by commissions, committees, and advisory councils dating as far back as the 1940s. People across Canada are making impossible choices every day because they cannot afford their prescription medications. Millions of Canadians have inadequate prescription coverage or no coverage at all. 16% of people in Canada went without medication for heart disease, cholesterol, or hypertension because of the cost. Over the past year alone, 1 in 4 Canadians were forced to avoid filling or renewing a prescription drug due to cost or take measures to extend a prescription because they could not afford to keep the recommended dosage schedule. Even those with private coverage are seeing their employer-sponsored benefits shrink, a trend that has accelerated due to the economic impacts of COVID-19. In fact, Canadians are twice as likely to have lost prescription drug coverage as to have gained it over the past year. Amount of prescription drug spending paid out of pocket in Canada in 2016 is $7.4 billion. Universal public pharmacare will extend prescription drug coverage to every single Canadian while saving us billions of dollars every year. The final report of the Hoskins Advisory Council found that once fully implemented, universal public pharmacare will reduce annual system-wide spending on prescription drugs by $5 billion. Businesses and employees will see a benefit to the tune of $16.6 billion annually for businesses, and families will see the out-of-pocket drug costs reduced by $6.4 billion per year collectively. So, Mr. Speaker, I ask the members to support this bill. Over 13,000 academic experts in the healthcare and public policy community support this. It is time for us to act. It is time to put the needs of Canadians ahead of big pharma.